Good morning, everyone. My name is Cindy Hopkins. I'm a part of the Delaware Stroke Initiative Planning Committee. It is my pleasure to introduce to you Dr. Lee. Dr. Lee did her residency in family medicine at Thomas Jefferson University. She did fellowships in geriatrics and clinical research at Thomas Jefferson University. She currently serves as the Director of Clinical Geriatrics at the Christiana Health System here in Delaware. She is the Medical Director of the Home Visit Program at Christiana Health System and the Medical Director for the Christiana Care's Visiting Nursing Association. It is my pleasure to introduce to you Dr. Lee. Thank you.
Okay. So let me just get an idea of who's in the audience, because, I run a very big house call program for Christiana Care. We serve pretty much all of Newcastle County, have about 600 patients. So medication adherence is like prime importance in my life. But I wanted to see, how you guys are, what your backgrounds are, and it's a small group, so we can be a little more informal, what your backgrounds are and some of the struggles you're having. So why don't you start? Oh, yeah. Okay. How about anyone? Right. How about you? Oh, yeah. Great. That's great. Yeah. You know that. Mm-hmm. Okay. Great. You? Yes. Yep. Great. You? Right. Mm-hmm. I know. Extremely. Right. Go ahead. You? Uh, right. Well, you're like the dream. Okay. If I walked in a house like that, I'd be like, oh my God, I need to clone you. Um, Go ahead. You want? Yeah, sure. Oh, fantastic. Yay! Yes, very challenging. Huge. Good. Oh, someone came. I know. Right. Okay. So, what I'll do is, I have a slide set, obviously, but feel free, again, small group, and I want to try to make sure I get your answers, questions answered as best as I can, and some of the things I do to try to do medication adherence. So I think our ex-Surgeon General said it best. Drugs don't work in patients if they don't take it. I'm like, that's so true. We have moved more. Used to, everyone say, are they compliant? Are they compliant? So now people are trying to use the word adherence a little bit better, because it really kind of tries to draw the patient into that dialogue and say, are the patients willing to take the medication? So it puts a little bit more on the patient, not just, us passing judgment. Are they compliant or not? All right, so first things, I just want to go through some statistics, and they're just so sobering that patients with chronic diseases normally take only 50% of the prescribed doses. They take less than what is stated on the label. We've all seen that. Some of them don't even fill their prescriptions. Some of them fill them and then don't take them. So we're battling this just on a day-to-day basis. The even more sobering data is that some of these patients, they had a stroke, you put them on blood pressure, aspirin, cholesterol medication, right? You would think this would have a major impact on them because they just had a stroke. They should know that it is so important to take these medications. But if you follow these patients, 1 year, 2 years out, that impact lessens, it wanes. And after a year, they're like, everything's same old, I'm just going to stop taking it, so that adherence starts dropping down the further they get away from that acute event. And the impact of non-adherence is very costly. It can estimate about 100 to 289 billion annually, and it's because some patients, because they don't take medications, they get sicker. So then they have to access the healthcare system even more frequently and have more aggressive interventions. So very increased use of expensive resources, medication changes, right? So you have had that experience where a patient, blood pressure is a great one. They come in with blood pressure of 190 over 110, and you're like, okay, you need your blood pressure. And you give them you have to take this. You have to. They come back and they're like, oh yeah, I'm taking it. And you're like, well, it's still 190 over 110. And then you're like, all right, I guess this medication isn't working, so I'll change it, right? But the thing is, they may not have ever even really taken it. So, one of the things to realize is that patients are very adherent to antibiotics and pain medications. Okay, and antiemetics, all right? So pain, if you're really sick and you feel awful, you're going to take that antibiotic, right? And if you're nauseous and vomiting, you're going to take that antiemetic. That's like a 90% adherence rate. Everything else is really poor. And mainly, if you think about it, is because you're asking a patient to take a medications where they're symptomless, right? So blood pressure, people come in with blood pressure readings 190, 110, I don't feel a thing. They don't feel a thing. So then you're like, well, this is really important. You must take it. They're like, all right, but I feel fine. I feel great. Like, why do I need to take a medication when I feel okay, right? So it's really hard to buy in, where it's very easy if you're like, you threw your back out and you can't straighten up and you're in pain, you're going to want to take that pain medication, right? Because there's a nice cause and effect. Whereas blood pressure, blood thinners, okay, like what cause and effect are you really feeling there? Not much. Or a statin, right? Is like, oh, it decrease the plaque. They're like, okay, I don't feel it. I don't feel the decrease in plaque. So then, it's really hard to have patients keep buying into it. So factors affecting adherence. So some people think there's an age thing, like older people tend not to be as adherent as younger. Actually, it's not true. Younger patients tend to be less adherent to medications than older patients. Health literacy, I think, is something, and I think this is Health Literacy Month, right? In the hospital, I just saw a big banner as I was coming in. But I don't think we do a really good job at also kind of figuring out what people's literacy is. How well are they really understanding our education? Because we talk a lot. I think, as professionals, we have so much information that we just want to impart to them so they can be just as knowledgeable as we are, and we're all in the same team and same plan. But we're talking like in a rapid pace, and that's just like, they're like, what? Like, what are you talking about? And oftentimes it's because we're not talking at the level they can really receive information on. So there's a great way to estimate adult literacy in medicine. It's called the REALM SF. So what it is there's actually a REALM. So this is the SF is a short form. There's actually a long form of 66 vocabulary words. I'm glad they shrunk it down to 7 because I'm like 66. So basically what you do is you put this in front of the patient and you ask them to read these 7 words. Okay. And if they're struggling for more than 5 seconds, you say, you just point to the next one and say, please move on. Okay. If they can't even say anything, you just tell them, you can just move on. You don't have to do it. And you basically what you're trying to figure out is how many do they get right. Okay. If they get 0 right, they have 3rd grade level and below. So they're not able to read even low literacy materials. So how they really understand things is really through oral instructions and illustrations. Okay. If they can get 1 to 3 right, then they're about 4th to 6th grade level. They will need low literacy materials. But the interesting thing, you think about it, I have a 6th grader and 8th grader right now. And I'm like, and my 8th grader can read prescription labels, and my 6th grader can probably do it too. But you got to think what can an 11-year-old do? That's kind of where they are. They're 11 years old, right? 4th to 6th grade. 4th is actually even less than that. It's 9? So what can a 9-year-old do? That's kind of where their educational level is. If they get 4 to 6 items right, they're now in 7th and 8th grade, so a 12 and 13-year-old. If they get all 7, they're high school level. Okay, and then so that you can kind of advance your educational material if they can get all 7 questions right. Basically, anything we put out there, they can read it and understand it. So, if this takes up too much time, if you're like, oh, I can't even get this done, right? One thing to ask people, which we never really ask, is how far did you go in your education? Just ask them that. People will tell you. They'll be like, oh, I got through high school. You're like, well, how much of high school? Some people, 9th grade, that's it. Then you got to really be like, oh, this could maybe even not be through junior high. They might be boosting it up a little bit. But, this is often very apparent when I see patients over and over again, and I'm giving the same instruction over and over again, and somehow it's just not sinking in, Then my red flags start buzzing, and I'm thinking, do they even understand what I'm saying? When I write things down, thinking that I'm making it clearer for them, is just gibberish to them. I had one patient who was a bad diabetic. We used to do these flow charts for her for when she needs to take her insulin, breakfast, lunch, dinner, bedtime, a sliding scale, right? So I really made it difficult for her. I was like, and you have a sliding scale, so if it goes to 201, then you need to increase. I was writing this all out for her, typing it up on Microsoft Word. I was I'm the best doctor in the world. And I was showing her this. And then she was like, yeah, okay. And then the home care team was the one who figured out. They're like, she's not literate. Because they would be like, okay, show us that thing that Dr. Lee printed out. And she would do it. And they're like, okay. And they were like, read it to me, And she couldn't do it. And then that's when they're like, oh my gosh, we can't do this. So we went to pictures. We did a lot of pictures with her, So it's really one of those things that you have to keep in mind. I forgot phrase. I love the I forgot phrase. He's like, oh, did you take that medications? Oh, no, I forgot. And I forgot is just so much more acceptable than, no, I chose not to take it. If some patient said that to you, you'd be like, what? How dare you? And I chose not to take it. But I forgot. I was like, oh, well, then you're blameless because, I forget too. So, but what is really behind the I forgot statement, right? Is it really they don't think they have an illness, so they don't want to deal with it? Some of my patients know they have heart failure, but they feel okay. So why do I have to take it? So when the symptoms improve and people feel better, they discontinue it. Very common. I have patients who are on antidepressants. Lady just came in the other day. She was on Celexa, was doing beautifully on Celexa. Good mood, sleeping well, eating well, happy. She comes in, now she's all of a sudden have a lot of psychosomatic complaints, also not sleeping well. She looked kind of a little bit more stressed out. But the reason why she stopped it, so she came in looking great. And then one day, a year ago, she was like, I feel great. I'm not taking this anymore. And I'm like, all right. I was like, well, okay, let's just see. Let's see what happens. But a year later, she's coming back to me, not feeling so great. And then, I brought up this Alexa. She's like, oh, you're right. I did feel better when I was on it. So maybe I should go back on it. But people feel great. And they're like, that's it, I'm done. Again, the symptomless thing and the lack of belief that medications will actually help them. They don't see a benefit, cause and effect, so why take it? And then there's this social stigma. I don't know if my parents are in their 70s, and I sometimes hear my parents talk to their other friends about their medications, so it's like something they talk about now. And it's actually a thing. They like brag about how many medications they do or do not take. I know my mom would be like, well, I only take one. Okay. Or my dad's more like that. And my dad was like, my wife's sicker. She takes 8, and I was like, okay, Dad, that's not nice. But they will all be like, oh yeah, she's so sick. She takes 10 medications. And I'm like, is she really so sick? Or maybe she's just compliant, so it's one of those things where there's a social stigma things.